Welcome back, everyone. We're not on Facebook right now because unfortunately there's some technical things going on with Facebook, of all things. My next guest has been on with me once before. I have with me Dr. Katie Balgeman, and she's the owner of Personal Wellness PT. I want you to tell everybody a little bit about yourself, but when you say PT, right away they think something that we're not going to talk about that much here today. So first tell everybody a little bit about yourself and what you do.
So I am a pelvic floor physical therapist, which those who've heard about it, when you know, you know. When you don't know, you need to know. So I focus on treating women and men who have pelvic floor dysfunction problems. So that is things like bladder, bowel, pelvic pain. So people who are peeing all the time or having leaking all the time, when they can't control urgency, when you're like a lot of abdominal pain, IBS, inflammatory bowel disease like Crohn's or ulcerative colitis, we can help with those symptoms. I help with women and men who have problems where they have pain with sex, or they something is going wrong in the bathroom zone. Basically, that's where I come in. And so what I do is I work both manually and with a lot of education, because this is stuff that no one ever taught us. Our moms did not tell us how to handle this part of our body. That doctors sure tell women that it's totally normal to pee your pants after you've had a couple of kids. It's not normal. It's common, but it's not normal, and it's something that should be fixed.
And I just want to say, I know that a lot of people have heard other things on the show, but for right now, this is completely different, and I'm getting it out there right now because I'm looking at it. I mean, it's amazing. You have it here, and it's not a chair, right? I mean, we want to talk about that. I want you to first explain what it is that you have here and how it works.
Okay, so what I have here in the studio, this is called the SoftWave. This is a type of shockwave technology. So shockwave is starting to get a little bit more popular, especially over the last couple of years. You'll see it in chiropractor offices, PT clinics. What a shockwave device is, it's a machine that will actually send a literal acoustic shockwave through the body. So we use it a lot for pain, tendinopathies, and to help stimulate healing.
Well, that's sort of funny. I mean, I just have to say, because when you say it's a shockwave that goes through your body and it's to help with pain, it sounds like it would be completely the opposite. So I need you to help us understand what that feels like.
So shock does not mean electrical. It's
that's thank you.
We're not electrocuting anybody here. It's really more of like a tapping sensation. But so there's different types of shock waves. So some people who go to like an orthopedic PT, they might have had shock wave there, but it's really radial shock wave. Radial shockwave, you know the massage guns where it's got the little ball? Yeah, radial shockwave is kind of like that on steroids. It's actually not even a true shockwave. It can be really helpful for things, but it's not really shockwave that's really stimulating your body to heal itself with your own stem cells. So then there's other kinds of shockwave. There's electromagnetic and piezoelectric. Those are very small treatment areas. They can get a little bit of depth, but maybe not a ton, maybe 2 inches into the body or so. The electromagnetic can go a little deeper, but it's very small treatment areas, so it's hard to find exactly where the problem is. So you need a lot of shocks, and it can be a little bit more painful to actually use those devices. So they can, but there's great research. They can be very, very helpful. It's awesome. This that I have here, this is called the SoftWave. So the SoftWave is electrohydraulic, and what it is we've got inside of this little applicator here is a plasma fluid-filled membrane. And inside of that is a spark plug. So when we turned on,
oh wow.
Yeah, it's dramatic. But it has this plasma explosion that takes place inside of the water here, and that is what creates that shock wave. Because it's 3 to 5 times the speed of sound.
Okay.
And so that sound wave, that's what goes through the membrane. The whole explosion part does not. It's just that pressure wave from the explosion happening. That's what goes through the body. And that's what triggers your body to heal itself.
Wow. This is amazing.
The cool part about this compared to the other types of shockwave I mentioned, so the treatment area here, it's really the diameter and depth of a soup can going through the body. So like I said, the piezoelectric and the other one, they only go 2 inches deep. This goes 6 inches into the body.
Wow.
We can get at your hips, we can get at your back, I can get at your pelvic organs.
So it can help with
all kinds of things. This is about as close to a magic wand as I've ever really seen.
Really?
And I generally don't like modalities, but this thing is super cool.
Okay.
So it can help with tendinopathies. I had a 17-year-old girl. She had Achilles tendinopathy on both sides. One visit, no more pain. She was hobbling during her games, and she could walk,
Wow.
and she could play normally with one session. It helps with arthritis pains and inflammation. It immediately, within generally that first session, about 80% of people get 50 to 100% improvement in pain. Might not last for more than a couple days to a week or so. We need a little bit more to keep that going, but we get some dramatic results immediately.
So, okay, I want to get some information out, okay? I want to talk about, first of all, is there somebody who's not a candidate? I want to get that out right
Sure.
away.
So the biggest things is we don't want to use this over areas where we could cause true harm. So because part of the way that this mechanism works is we're going to increase blood flow to the area. Blood flow is healing. Blood flow is what allows the bad inflammation to get washed away, to bring in healthy inflammation to heal damaged areas. But things like active cancer, when there's a tumor over the area, I don't want to put this over that because it's going to bring more blood flow
Yeah,
potentially
not
to
a
a
good
tumor.
thing, right.
Don't get me wrong, cancer is inflammatory. We want to reduce inflammation in general, but definitely don't want to go right over that.
Right.
Same thing with a pregnant uterus. So if there's a baby inside of a lady, I don't want to use this directly over that baby, but we can go in other areas. Same thing with the cancer thing. Someone's got, breast cancer, but they sprain their ankle or their knee
Right,
is killing
right.
them. We can totally do that.
Okay.
The other big one that everyone should know is that if you're taking anti-inflammatories, corticosteroids, something that's going to dampen down your pain response and your immune and your inflammatory response, we want to make sure that those are as much out of the system as possible.
So, I was just gonna ask you, let's say somebody does, because some people do that
Right,
often,
absolutely.
right? And if they're hearing this, how long, let's say you come and they say to you, I'm on it, what do you give them, a week? How long does it take to get out of their body?
So it depends. So if we're doing like over-the-counter aspirin, Advil, whatever, we want to give them at least 1 to 2 days.
Oh, okay.
To get that just to, they're
That's
not
not
take
bad.
it. No.
Mhm.
If they've had a cortisone injection though, we want to give it 4 weeks.
Okay.
Then we really want to let that one kind of
Right.
move out of the
But
general
can you
area.
imagine, folks out there that are listening to this, that if you had those cortisone shots are terrible and they hurt, number one, and you have to do them more often. You said this one girl had it where she did one treatment and she was able to walk. Can you imagine not having to do that?
Well, and really long-term use of anti-inflammatories actually increases chronic pain because your body can't go through its normal inflammatory process the way it's supposed to so you can heal. It's totally disrupting the way your body's supposed to work. So yeah, our goals are to try to use as many natural options as we really can. And this is super safe, it's very effective, it's not invasive, and it's so cool.
You were finding it. You're so excited about it.
I
And you
love
know
this
what
thing.
she is. Let me just tell you, you called me, I don't know how long ago, and you said, Carol, I gotta get back on your show because I have something that everybody needs to know about. And let me tell you something, folks. She does what they call like a free conversation over the phone, so she'll talk to you and get a little bit about your stories. Everybody, again, people who are in pain, okay? What others?
So we can also use this for like the pelvic floor conditions. So
I wanted to ask that because we started off with
I
that.
know, right? We gotta circle back. So when I have patients who have something called vaginismus or dyspareunia, basically it means that the vagina is like tight.
Really mad?
Right, it's mad. And so that means that things like sex are so painful, you just can't do it.
Mhm.
This is gonna get more blood flow and help everything relax to really speed along the process of going through your normal physical therapy so you get better faster.
Wow.
And you get more healing from it. So those benefits we get from therapy are gonna last longer too.
So, do you have all of this information on the website?
Yes,
It's
I've got
on there.
Lots of information
Good.
on the website.
Good.
And then the other, because one other big one too with this guy, there's lots of research on, is for erectile dysfunction too.
Okay, we'll talk about that because that's that I've heard of that shockwave, but I'm seeing this. It's here. We're on our video right now, so I could say it's amazing how it works. Do the little thing again for everybody so they can see it on the web.
So it's gonna click.
It clicks, but it doesn't. It's not
No.
clicking you.
Here, throw me your hand. So give me your palm.
Mm-hmm.
When there's areas
Oh,
that
it doesn't
don't-
hurt at all, folks.
No, when there's no pain, no inflammation, no damage, it really just feels like tapping.
Yeah.
Once we get over an area that really does have the inflammation and pain, that's when you're gonna feel it.
Question: how about somebody who has sciatic nerve? Totally, okay, see, now we are gonna go to a break. When we come back, we're gonna talk further. She's located in Ahwatukee off of the, I-10 and Elliott. She does free phone consultations. Her phone number to call, it's 480-485-6574. The website is personalwellnesspt.com. And I wish that we could see this on, but you know what, we're gonna have it on the video, you'll see it on my YouTube channel. But honestly, folks, when I see something like this is almost groundbreaking, if you say it like that. Groundbreaking, I said it wrong, right? And amazing, and anyone that's listening, you should really check this out, especially if it's you or someone that you know that's dealing with pain for a long time. Again, that phone number is 480-485-6574. It's personalwellnesspt.com. Hang tight, we'll be back in just a minute. Do you like what we're doing?
Yes, one thing I do want to make sure, because
Yeah.
it drives the point home too, is the history of how this came to be.
Okay, so we'll do that when we come back. We did a lot
It's on my,
here.
I know, it's on my little thing too, and I forget, see, that's why I give myself notes that I started looking at.
history,
Yes, the history,
okay.
because really the,
But also, I want to ask you, I don't know how much this whole deal is for somebody to come in for a treatment, and it's obviously not covered by,
no,
right, so we don't talk about that, but would you like to enter anybody in to win? What is the,
I was thinking about that when she had hers. So my mapping session is $50.
okay,
So it's just that's the introductory, just so people can kind of see it and see how it's going to work for them. I'm fine with giving away one of those.
okay, so we'll do that, let's try it. I mean, we only have a very
It's a
short
short period of
time,
time now, yeah.
but we'll try it, $50 value.
Yeah.
And what did you call it?
It's a mapping session. So we
Mapping
actually,
session.
wherever the area is, we do a full treatment.
Uh,
And so then if they're going to improve, then we can see right then and there. Because
Okay, gotcha.
you get those dramatic
Get it.
improvements immediately.
Okay. You okay?
Yeah. Yeah, we're not going to talk about that.
I
I
feel-
can't imagine we're going to get to the red light. I've totally
Well, we're
not
gonna
even thinking
try,
about it.
but I'm
Not even
gonna
thinking about
try.
it.
We can.
We'll see what happens.
Well, it's right here.
Yeah, it's like a matter. Like my thought process was gonna mention it, but then again,
It's hard to, because you know why? You are on fire with it.
I like
yeah.
talking. I know.
Yeah, but you are loving it. You love what you do.
Oh yeah. Yeah, 2025 is definitely gonna be a good year.
Yeah.
That's what I'm going with.
I just want to make sure she's on this list. You've already pretty much said a lot of that. Conditions we did.
The other big one then, because we didn't even talk about what I do, because I also treat lymphedema and chronic swelling. So that's one where we've been using this with lymphedema more and more. Very niche kind of people, but like that chronic swelling side of it, especially cancer related.
Okay. You've got the pricing. I'm not even gonna go there.
We'll get there. Yeah. Okay.
It's
Yeah.
not
I will. I'll
important.
mention how much it is, and that is uncovered.
If you
and
do,
all
you
that.
do. You don't. It's not important.
Oh, the other one too is healing after surgeries, because that's another one I want to make sure that like it helps with any surgery, cosmetic surgery, orthopedic surgery.
Can you do it on the face?
Yep.
Okay.
All kinds of stuff.
It's a long one. These are all the people that come on my show. They're my people that get ads from me.
Yeah.
Okay. Welcome back. We're on fire here. And the reason why is because this is something, first of all, I gotta ask you, are there a lot of people that use this modality like you do?
It's starting to get a little bit more popular, but it's really most of the people, especially in here, especially too, that have it are chiropractors. So it's kind of part of that chiropractor model. We're going quick in and out. Let's turn them and burn them. What I like to do with this is I like to spend some time. I want to make sure that we are using enough of these pulses that we're not going to just like get everything kind of angry. Because like I said, when we get over that area that's got the inflammation, it's not the most comfortable treatment in the world.
Mhm.
But we gotta make sure we get it to calm down, because that pain will go down during the treatment.
And that blood flow is gonna go back and you're gonna feel great.
Exactly.
I do wanna open up the lines to the audience right away, because we didn't do it for the first half. We talked about it at the break. We decided we're gonna open up the lines to the audience for everyone to get. It's called a mapping session. It's a full treatment that you find out whether this is right for you or not. It's a $50 value, free to you or anyone that you know. And our number here is 602-277-5369, and toll free it's 1-866-536-1100. So we were talking about, I said sciatic nerve. Let's say somebody had been hurt for a while,
Yeah.
a long time. Does it matter? How
No.
long? Okay.
No, so when we have that's more of an acute injury, like someone gets in a car accident and they get a bone fracture, or right after surgery even, this will help a lot with those acute conditions. We do it a little bit more frequently because we want to jump right on top of that healing. We're going to minimize scar tissue. We're going to speed up the healing process. So we usually start with like twice a week for a couple of weeks, and they go to once a week. Something more chronic, it's more like once a week, maybe even less, as we're kind of moving through. We'll start spacing them out, because your body's going to start healing. And that healing happens for 12 weeks after every session, no matter what.
Non-invasive. It
Non-invasive.
is also, doesn't hurt. And I don't know if it's FDA approved.
It is actually FDA cleared.
That's really important, FDA cleared,
Mhm.
okay, that's really important for people to know, and it's safe. So our number here is 602-277-5369, and toll free it's 1-866-536-1100. If you're dealing with any kind of pain, any kind of inflammation, you even said that it does help with erectile deficiency.
Erectile dysfunction, it helps with neuropathy.
Uh-huh.
It helps.
Oh, good.
That's another really good use of this one, is the neuropathy. It helps with scar tissue, like C-section scars and cosmetic surgery scars.
Yes, you said that's the other thing. You said that it does help for helping after surgery.
Mhm.
And I asked you, well, can somebody do it on their face? And you said
Yes.
yes. And you know what? It doesn't hurt. I just did it. She did it on my hand, and it doesn't hurt at all.
Yeah, well, because there's nothing wrong with your hand right now.
Nothing wrong.
If you had
Well, there've been
inflammation, it will hurt. We want that. We're looking for that.
Mhm.
If so, say
When it hurts, but how bad?
depends. So we want to keep it tolerable. So
Mhm.
I want to keep that pain that we're during session to like 5, 6 out of 10. If we're getting more than that, you're going to tense, and you're not going to let your blood
Right.
flow get to the area which we need.
Mhm.
But I also want to make sure we're at a therapeutic level of pain.
Mhm.
And that pain goes down during the session. That's the whole point. We're getting the pain to go away.
And eventually the pain is gone.
Yes.
Right. So, and it can happen.
It absolutely can happen in one session. And sometimes that's all you need. You don't even need to come back for more.
That number to call here is 602-277-5369, and toll free it's 1-866-536-1100. It's a mapping session. It is a full treatment that finds out where you need to be and does this work? Or is it right are you a right candidate, right? Is that what you would say?
Yeah.
It's a $50 value, free to you or anyone that you know. Our number here is 602-277-5369, and toll free it's 1-866-536-1100. Did we talk about the history of it or not yet?
Not yet.
Okay.
So this is actually a direct descendant from lithotripsy, the treatment they would do for kidney stones. They use the exact same, but much higher intensity sound waves to go into the kidney and break up kidney stones so you can pass out. But what happened was, during those treatments, they found they were finding that the vertebrae that were getting part of this treatment, they're starting to heal from the degeneration that people get. There was a woman who had a non-healing, it was chronic rib fracture. She got her kidney stones treated, her rib fracture started to heal. So they're looking at it like, what is happening here? And so they found out that it was the shockwave. So they turn the intensity down so that it's something that you can tolerate. It causes 0 tissue damage, no micro trauma. In fact, this actually helps wounds heal, like diabetic ulcers even, it helps them heal.
Wow.
And so that's where they kind of were playing around with it, and then the soft wave was born. It's like, yeah, they're just proving that it's helping to heal people.
And it's FDA cleared. I want to say it right.
Yes.
Cleared. And you know something, it doesn't hurt and it's non-invasive. It is sure worth having that $50 value, free to me. Have you come in and have you check that out, because if you've never heard of something like this, it could be life-changing.
Absolutely, it could.
Right? So our number here is 602-277-5369. Toll free, it's 1-866-536-1100. Check her out on her website. It's personalwellnesspt.com. You can also call her. She does free phone consultations. Her phone number is 480-485-6574. call in here and get this treatment. That number is 602-277-5369. Lymphatomab, whatever that is. What is that?
Lymphedema.
Lymphedema, I couldn't say it.
That's okay. So there's a few different things that can cause
What is it?
lymphedema. So it's swelling. It's chronic swelling. It's damage to the lymphatic system in one or more limbs usually. So one of the more common ways is like leaky veins. So it's just swelling that's always there, and eventually it just causes damage to the lymphatics, and then that swelling does not go away. Another thing that can cause it though is cancer treatments. When they remove lymph nodes to see if the cancer is spread, that damage to the lymphatics causes the swelling. So you get big swollen arms or into the legs. So with those patients, what we have started doing, and we're getting research that is coming out with this too. When I use this in the clinic for lymphedema, I'm working over the lymph nodes, especially when they were removed because of cancer, to help stimulate the lymphatics to start working a little bit more. And ideally, we don't know this for sure yet, but we know that this will create new blood vessels. Stands to reason it might be helping to regenerate some of the lymphatic vessels. Not the big ones, not the lymph nodes, that stuff's not gonna regenerate. But if we're creating new pathways for fluid to flow, we're finding that the swelling is actually getting at least a little bit better. We're not curing things, it's not a miracle. I want it to be a miracle so bad, but it's so much closer than we've been.
What is the number one thing that people come to you for when they know that you have this?
Pain.
Pain.
It's absolutely a pain. Because
So they have a slip disc.
Slip disc or some kind of a tendinopathy. They're just like, back pain hurts. Probably one of the ones that I've been seeing a lot of is knees. Like, I've got a guy right now, he had a total knee replacement. His whole knee is one giant ball of scar, and it won't bend. We've broken through this scar tissue, and he's gotten 15 degrees of range of motion in a few weeks.
So anybody who plays pickleball, if you are having trouble,
Oh yeah,
and you want to go back on the court, she can help you.
absolutely.
Wow.
And then the other big one that I love for this that I want more of is postpartum. Turns out having a baby is an injury, just when you choose to go through. But for all the things that can go wrong, C-sections, but tearing, just the pain of actually having to go through it, you can come in immediately. It is safe to use immediately after any surgery or injury to come in and help get that healing started, especially when there's tears.
Why is it so important to have something like this done after surgery?
Because we want to minimize the scar tissue that forms, because especially like orthopedic, that's going to limit range of motion and it's just going to cause more pain. But we're stimulating the healing process so the rehab goes faster. And then also for things like cosmetic surgeries, like liposuction, tummy tuck, even like breast augmentation, we want minimal scarring. That's the whole reason you're going to these plastic surgeons, so that we can make everything look nice and move better and nice and smooth. This helps with that healing process. It all goes faster.
We've got our lines open here for everyone to get entered into when it is called a mapping session. It's a full treatment that you get, and sometimes people get a relief from this, from their pain, in one treatment, but you won't know until you try. And it's a $50 value free to you or anyone that you know. Our number here is 602-277-5369, and toll free it's 1-866-536-1100. What would you want to talk about now with it before I take over the whole thing?
Totally. We have one other thing I like to pair with this guy. So this is great for local. You can tell it's got this big treatment area, but it's still small in relation to the whole human body. What pairs really well with this is red light therapy. So if you've ever heard of it, red lights, our skin absorbs it, and it actually will stimulate cellular regeneration, improve cellular energy, collagen production. It's great for wrinkles, lots of good stuff. And then infrared light helps with inflammation and joint pain. I have a panel that's got a focused red light to it, so it actually penetrates even deeper than normal red light. This is brand new. I'm the only one in the state with it.
Wow.
It goes deep and it
We're gonna have
pairs
to
so
come back.
well. I know, I'll have to come back for that
Amazing.
one.
Oh my gosh. Well, you know what, there's so many people out there are reaching, right? They're reaching for help because they can't find the relief that they're looking for. Certainly this is worth the try for sure. And you know what? She's had patients, the one with the foot that had was limping around, she walked out of the office and was back out on the courts. We've got our lines open here. It's called a mapping session. It's a full treatment for you. It's a $50 value free to you or anyone that you know. Our number here is 602-277-5369. Toll free, it's 1-866-536-1100. Everyone's getting entered in to win. It's FDA cleared. You can check her out on her website. All the information is there. It's personalwellnesspt.com.